everyone, it's Dr. Rick and this is Aiden. We're gonna do a co-video today, right buddy? I wanted to talk about or unbox this. This is a homeopathic eardrop. It's eardrops for soothing somebody with ear infection. Now, there's something called acute otitis media. That's when you have an infection in the ear. Usually it's bacterial, but it's diagnosed by fever, irritability, and a red eardrum or tympanic membrane. Sometimes even just fever and a fluid level. That's called serous otitis. But because of bacterial resistance, meaning antibiotic resistance from bacteria that are out there in the community, in the world, doctors have been trying to decrease the use of antibiotics. I think that it sometimes backfires and goes the opposite way, where doctors just say no to everything that walks in. I'm not saying every doctor does that, but I've heard stories where moms go to the doctor's or call the doctor's office and they say, my baby's fussy, baby won't eat, baby's got rashes, baby's got diarrhea and a low-grade fever. And that requires investigation, to me, especially when you can't get this guy to eat or your baby to eat. Now, it doesn't mean that we have to automatically throw antibiotics on, right? You don't want to be throwing antibiotics on everything because you'll have bacterial resistance, or in the individual, that's bacterial resistance all over the world. But in this individual, every time you hit with antibiotics, especially azithromycin, that's for adults known as Z-Pak, it's the 5-day one. It's pretty decent, it's broad spectrum compared to amoxicillin, but it wipes out everything in the gut. So it usually will wipe out in bacteria here, sometimes bacteria here in the chest, the typical ones that cause infection, but that's great if it's a pathologic bacteria that's causing problems. Damaging the bones in the ear or having a pneumonia is not good. But if you do it too frequently and you don't give the gut microbiome enough time to rebuild itself or rejuvenate, which it should be able to do, you will irreversibly destroy the diversity of the bacteria in the gut microbiome. And I've done videos on the gut series. Check it out. I'll put them down below, at least the links to my website on YouTube. So in the case of the homeopathics, because a lot of doctors don't like to give antibiotics, I think that that's fair. But that doesn't mean that we just let a kid cry all night. I mean, certainly we could have somebody that's teething. Let me see. Got any teeth in there? No, I don't have any teeth. So if you can't find anything, I mean the doctors can't find a red eardrum, can't hear a row or a rhonchi in the chest, can't see a sore throat, get a negative strep, have a negative COVID, then it's fair game to say, okay, maybe it's viral. If it's a viral infection, it'll probably run its course. But just because it's viral and there's nothing you can really do for viruses because antibiotics don't really help viruses. However, if you just let that go and don't give the parent any information on what to do with pain control, fever control, irritability, that's unfair. That's gaslighting. So my suggestion is consider this. Now, some doctors will say homeopathic medicines, they don't work. These are over the counter. Technically, homeopathy is the delusional concept where they take the ingredient that causes the same symptoms as fevers, chills, earache, and they dilute it. It would be a chemical or a stone or a metal, but they dilute it down to 1/1000th of a fraction of what it originally was. And in theory, if you give somebody a touch or a dilutional amount of that thing, it should reverse the symptoms. It's important to understand the concept, but I'll probably do a video one of these days. Some of my colleagues will say that's hocus pocus and that's placebo. However, using this, there have been studies here. Sorry, this was in my diaper bag. So here's one study that showed benefits, modest. Here's another study that showed benefits. So hopefully you guys can look that up. Essentially showed benefits to the use of topical eardrops to assist in the pain control of somebody that's getting better with or without antibiotics to run its course of an infection. Because if you have a fussy kid that is not eating, that's not good. Not drinking, that's definitely not good. You'll have a dehydrated kid. And a dehydrated kid with a fever, even if it's viral, will get worse. And they can have seizures. So I always say it's important to understand what to do. Oh, by the way, here is the ingredient label, if you can read that. This is the bottle. That's how it looks. It's a little blurry, sorry. But you essentially, I'm not going to do it with Aiden, but essentially put, the studies were 5 drops, 2 times to 3 times a day. There's 2 different studies. One was 2 times a day, one was 5 times a day for 5 days straight. In theory, not in theory, but in the results, it showed an improvement in the child's outcome, faster resolution. Hello. So, to me, that's a win. And then there's no downside to this. Again, it's solutional, number 1. So essentially, it could be just water. Number 2, it's also topical, so it doesn't get in. Just allows you to drop a drop of liquid on the eardrum to soothe. And there's no temperature in this. So some of my colleagues would say it's placebo. Is this placebo? Can he understand the concept of what a drop is? He can't. Can the parent understand the concept and then make him feel better? I don't think so. That's like a reverse Munchausen. So I do think it's worth it, especially if you're a mom that can't sleep and you have to constantly hug this guy or your gal or guy until he gets better. It's important to, yes, it is. See, he gave it a thumbs up. It's important to use conservative measures. It's important to have little kids calm, pain-free, and hopefully sleep well. Because if they don't, then it makes parents worried, and when parents get worried, then the whole household is amiss. So that's a thumbs up on this. Again, no downside. Even price, it's I think it was $10. Price is low, it's topical, it's dilutional. And then again, NIH studies said a modest improvement, worth a try. So I'd say give it a try. Here, this is one. This is not the exact homeopathic drops that were used in the studies, but I think that with homeopathy, it's important to consider using just conservative measures, and this is definitely conservative. You want to hold this, buddy? Hold it up for the camera. Hold it up for the camera. There you go. Give it a thumbs up, maybe? Let's give it a thumbs up. I think he likes it. Hey, Aiden, he likes it. So give it consideration. For those of you who don't have any ideas what to do, or ask your doctors. This is always information to be brought to your doctors to see if it pertains to you and your child. But don't do it on your own, please. This is just an educational video. And if you are not a subscriber, please consider hitting the subscribe button down below. I do videos weekly, not usually pediatrics, but I thought I'd talk about this because of one of my clients outside the US. So remember to stay safe. It's going to be spring. Get rid of your comorbid conditions before fall comes, because I have a feeling we're going to have a bloom of COVID again. So stay healthy. Talk to you in the next video. Thanks for watching. Damn, he's bored. Sorry, buddy.